It's only 5:30, but how many of you are already thinking about heading to bed after a Monday back at work? The idea of a great night's sleep really sounds good. Sometimes it's easier said than done. That's why today we're talking all things sleep and providing recommendations for a good night's rest for all ages. And we're going to talk about how to prepare for the upcoming daylight saving time. Dr. Pallavi Reddy, a sleep specialist in the Triad and member of the Cone Health medical and dental staff. She's here with us today to give us all of her wisdom and expertise. So we're going to talk about from young kids all the way through adults. Let's start with the youngsters, right? The babies. You have a 3-month-old yourself. So what are the recommended do's and don'ts for the babies for sleep?
Hi, Tanya. Thanks for having me. Well, there's a lot going on in a baby's brain and body in the first few months. Newborns and infants need 14 to 17 hours of sleep in a 24-hour period, including 2 to 3 naps. Consistency is key. Babies start to recognize a routine. Like you said, as a new mom myself, I use the eat, play, sleep schedule for my baby. First, I feed the baby, keep her awake, and then play with her until she gets drowsy and then put her down to sleep. I repeat this schedule throughout the day.
That way they know, okay, this is what's going to happen. I'm going to eat, I'm going to play, I'm going to go to bed. I'm going to eat, play, and go to bed. Okay. All right. What about the school-age children? How many hours do they need?
So in this age group, high quality sleep is essential because it helps with problem solving, language development, and attention. So 3 to 5-year-olds need 10 hours of sleep per night, and this can include an optional nap. And kids aged 5 years and up should be striving to get 9 to 10 hours of sleep per night.
Okay, you said 10 and up should get how long?
9 to 10 hours.
9 to 10 hours. Okay. So when we talk about this, we always think to ourselves, you know, how much does sleep impact us as adults? How much does sleep impact the kids if they don't get enough?
So it can definitely have an impact long term on their attention, obesity. It can affect their moods. So it can definitely have some long term consequences.
Okay, let's talk about adults. How many hours are recommended? Because I'm sure there's a bunch of adults out there who are everything from the gamut of I only get 4 hours of sleep to some of them get like 8 or 9 hours of sleep.
So that's a $1 million question. Research has actually shown that sleeping less than 6 hours and more than 9 hours per night is linked to heart disease, stroke, and a variety of other medical conditions. So the sweet spot is 7 to 8 hours of sleep per night.
7 to 8. Okay, so let's talk about a good sleep routine for adults. Like, I know you said the sleep routine for the baby, there's a good sleep routine for kids. So what is the good sleep routine for adults? Because sometimes we don't follow all the rules like we should.
So similarly to children, I recommend winding down 1 to 2 hours prior to bedtime. Definitely avoiding caffeine several hours prior to bed too, like 6 to 8 hours if possible. And the most important is limiting electronic use 1 to 2 hours before bed. That blue light that comes from your laptops, TVs, your cell phone can emit signals that can suppress the melatonin that we all naturally produce in our brain that makes us sleepy. So that's very important. This day and age where everyone's using their electronics in bed is something that I talk to all of my patients about. And lastly, listening to your body when you're sleepy. So when you get home and you feel like you have a second wind after the kids are asleep and you want to watch your favorite show on Netflix, avoid that urge and listen to your body and invest in your health and just go to sleep.
Is it okay though if we get that second wind and we do something that is not like TV or screen related?
Certainly. So having a relaxing activity, whether that's listening to soft music, meditating, reading a book. The key is to not do those activities in your bed though. So finding a quiet place in your house, whether that's your living room or your bedroom, like a cozy chair, and dimming the lights. We also say that dimming the lights after 6 p.m. can kind of help set the tone and the mood for sleep.
Okay, and don't do it in the bedroom. And that is because we should just keep the bedroom for sleep and sleep only?
Yeah, so we want to associate our beds with sleep, and sleep is a learned behavior, just like how we teach babies and young children to sleep. So when we relax in our bed or just hang out, our brain is confused. Do we sleep there? Do we watch TV? Do we do homework? Um, so that can be a little bit confusing and stressful.
Okay, all right, good to know. All right, we're going to continue on this conversation because we all need a better night's sleep. We'll be back in just a few minutes. Welcome back. Dr. Reddy, a sleep specialist in the Triad and member of the Cone Health Medical and Dental staff, is here talking about all things sleep. All right, so as we get older, how does the lack of sleep impact our health?
So lack of sleep in adults can lead to obesity, heart disease, stroke, mood disorders like anxiety and depression, and it can also reduce our ability to fight infections, whether that's COVID or the flu or even cancer in some patients. So definitely a good quality sleep can impact our health as a whole.
All right, and so what should you do if you just, sometimes people just can't fall asleep at night. So what should you do? Is it the counting of the sheep or what is it?
So like I talked about earlier, it's so important to have that winding down time, 1 to 2 hours before bed. And once you find that relaxing activity, whether that's reading or relaxing, listening to music or meditating, when you find yourself awake for more than 20, 30 minutes, of course, don't count the clock, but get up and go to a quiet place and start that whole bedtime routine process all over again and distract yourself from the fact that you're awake because simply distracting yourself from the frustration of not sleeping can make you sleepy. And once you feel drowsy, get back into your bed and try again.
Okay, and should we do that same thing if we wake up in the middle of the night at 3 o'clock in the morning, or should we try and stay in the bed?
So I would avoid staying in bed. Definitely break the cycle and get, even though it sounds counterproductive, definitely get up and find that quiet place and break that cycle and continue that relaxing activity.
Yeah, and it definitely is frustrating when you wake up at that 3 o'clock in the morning and you can't go back to bed. All right, so daylight saving time begins this coming weekend. We're going to be setting our clocks ahead an hour, so losing some sleep. What steps should we be taking this week to prepare?
So adults may adjust easier than children. Kids do best when we nudge their schedules in baby steps. Gradually shift your child's bedtime over the next few days before the clock changes. So every evening, advance your bedtime by 15 minutes. So if your child's bedtime is 8 o'clock, you can shift it to 7:45, and then the next night 7:30, and then the night after 7:15 until you get to 7. So some kids do fine with 4 nights, some kids do fine with 2 nights, but it just depends on your child's temperament and how good of a sleeper they are to begin with.
Okay, in just 10 or 15-minute increments seems like something that could be bite size and chewable and be able to handle that instead of just bang an hour earlier than at the end of the week. All right, so if we don't prepare ahead of time, what kind of impact does losing that hour of sleep have on our health, whether it's kids or adults?
So for kids, this can definitely affect their moods. It can make them more irritable. It can affect their appetite, their attention. For adults, same type of symptoms, probably more so mood disorder, just more irritable, and one dangerous thing could be drowsy driving. If adults are not getting enough sleep, that's a safety concern, and that needs to be avoided.
Okay, we've got about 1 minute or so. If someone is having trouble sleeping, at what point do they consider seeing a sleep specialist or having one of those sleep studies?
Great question, Tanya. So if the sleep disruption is affecting your life, your quality of life, and it's been persisting long term, I would definitely say it would be time to see a sleep specialist to see if you are a candidate for a sleep study.
And you can do some of those sleep studies at home. You don't have to go to the lab.
That's true. So we are doing home sleep tests for the right candidate. And that would definitely be something to talk to your sleep specialist about.
Okay. Thank you so much for your time and your expertise. And everybody needs to have a better night's sleep. If you missed any of today's Q&A, you can find it on our website. It'll be in the To Your Well-Being section.